clearly a bit of a discrepancy happening in Queensland between the health department and the actual health system. I mean, the health minister has claimed that Queensland apparently has one of the country's best performing ambulance services, but a 2023 AMA ambulance ramping report card says very much otherwise, reporting that ambulances spent, get this, 134,155 hours parked outside the top 26 Queensland hospitals. How can Queensland Labor be so out of touch?
Yeah, those figures are hard to fathom, especially if you're sitting in the back of one and you're going through chest pains and on the brink of a heart attack, because that's what's happening with a lot of people throughout this state. Sadly, what's happening, it's a combination, Daisy, and it's an issue that ambulance officers and nursing staff or hospital staff in general can't speak openly about. And the issue that I see is that because we've got nurse to patient ratios here in Queensland, when an ambulance turns up to any hospital, it can be a small remote one in Yeppoon or it can be Rockhampton or Brisbane, what happens is if the ratios are out of whack with the nurses, they can't take any more people through those emergency doors and find them a bed on a ward. So at present, the current ratio is 4 to 1. So for every 4 patients, you've got to have 1 nurse. And so when they're out of sync, people stay in the back of ambulances. That's the issue here, and no one's prepared to address that.
Why is no one prepared to address it? That's what gets me. I mean, this is such a well-known problem with Queensland healthcare. Like, why is nothing done about it?
Well, one of the biggest issues is because when the Premier or the Health Minister themselves turn up to a hospital, they give the hospital a heads up and an opportunity to hide patients, empty beds. And we're seeing some very serious issues in this state right now where when a Premier arrives, say for example at Rockhampton Hospital, which is closest to me, the issue is that those nurses and doctors on wards are simply saying, well look, we think you are fine enough to go home right now. But this is where the tragedy starts as well, because these people are discharged from the hospital and then find later they either relapse or worst case scenario, they die at home. And so we are getting a false impression of how hospitals operate when we allow Prime Ministers, Premiers, Health Ministers to turn around and give a heads up to these hospitals that of course they want to look like they're doing the right thing, but it's giving a very, very, very unreasonable look at what's truly happening behind the scenes of most of our hospitals across this state.
It is not fair and it's not good enough. I mean, the thing about Labor, as we know, is that whether it's at a state level or a federal level, they just tout themselves as the ones who are good on health or good on education, but particularly health. How can they look the public in the face and continue that mantra, particularly in Queensland, when you've got the healthcare system in such a not just recently poor condition, but well pre-COVID in such poor condition?
Well, you're right when you point out pre-COVID problems. Well, we didn't have as big a shortage of nurses as we know. The health system, both with ambulance and the hospitals, had a mass exodus of hospital staff because they didn't want to go and get that COVID shot. Also too, there's enough bureaucrats right now in our Queensland system that are happy to climb the greasy pole by telling politicians what politicians want to hear rather than what the public want to hear. So until we get some bureaucrats at senior level that are prepared to be honest with their ministers, because not all the time is it the minister's fault, sometimes it's departments as well, but you have to have a minister that's strong enough to be able to just rock up to a hospital unannounced and see for themselves precisely what's happening and then ask questions of those bureaucrats. Why have we got the congestion? Why have we got the ramping? The truth is there, and a lot of people, if you ask the so-called bottom dwellers, as you know, the top bureaucrats would call them within the hospital system, will actually be honest and tell any politician what the real issue is. They're certainly telling me when I meet with nurses, when I meet with doctors and when I meet with paramedics, they're all telling me. So that's why I'm able to tell you what the truth of the matter is.